everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about chronic renal failure. Now, if we see the term chronic renal failure, we can understand that this means definitely renal failure means kidney failure, right? And we also have a term chronic that definitely signifies that this has happened over a long period of time. So that is what is chronic kidney failure. Now, when we are telling that renal failure or kidney failure, that definitely tells us that the kidney is not able to function properly, right? That's what we understand in general. So let us go into the meaning of chronic renal failure to understand it in more better way. So chronic renal failure is an irreversible destruction of nephron leading to severe deterioration of renal function, finally resulting in end-stage renal disease. So we have already learned while discussing about acute renal failure that there would be deterioration of renal function. And here what we can see the differences in chronic renal failure, this deterioration would be severe. So there would be severe deterioration of renal function. And also we get one more term which is irreversible destruction of nephron. And that means that the nephron which are getting destructed or damaged, it cannot be reversed with medication or with any sort of treatment. It is irreversible. So is there any characteristics through which we can differentiate between acute renal failure and chronic renal failure? Definitely chronic renal failure would happen over a long period of time and it would be severe deterioration. But along with that, there is also something called severe proteinuria, and also we can see that the glomerular filtration rate would be less than 60 ml per minute, and that would be there for more than 3 months. So when it is there for a long period of time, suppose for more than 3 months, and then we can see severe proteinuria, we can, it's a hint that it is a chronic renal failure. Now moving on to the etiologies of chronic renal failure. So here, the etiologies are slightly different from for children who are less than 5 years old and for children who are more than 5 years old. So for children who are under 5 years old, for them it is mostly congenital anomalies. So the etiologies can be renal hypoplasia, renal dysplasia, or obstructive uropathy. And apart from these things, if there is congenital nephrotic syndrome or polycystic kidney or renal vein thrombosis, these things can also cause chronic renal failure in children. Well, after 5 years, it is mostly acquired or it can be due to any inherited disorders. So the causes can be glomerulonephritis, Alport syndrome or cystinosis, or if there is polycystic kidney disease. Well, that was all about the etiologies of chronic renal failure. Now moving on to the stages of chronic renal failure. So as we are saying that this happens over a long period of time and we can see that there would be a significant reduction in the glomerular filtration rate. So we also say that, if it is less than 60 ml per minute for more than 3 months, we consider it as a chronic renal failure, right? Now, this is not acute, right? So this takes a long period of time to occur. So that is why, there are different stages. The glomerular filtration rate also can be a different level. So based on that, we have different stages of chronic renal failure. Well, altogether, we have 5 stages here. So first one is there would be kidney damage, but if we see the glomerular filtration rate, it would be normal or it would be more than 90. In the second stage, there would be kidney damage, but along with that, there would be mild reduction in GFR. So the GFR would vary from 60 to 89 ml per minute. Then we have the third stage, which we call it as moderate stage. Here we will have a significant reduction in the GFR that would be around 30 to 59 ml per minute. And then in the fourth stage, there would be severe decrease in GFR that would be 5 to 29 ml per minute. And at last, the fifth stage would be that is kidney failure, that would be less than 15 ml per minute. So GFR rate will be less than 15 per minute. So you can see here from the first stage to the fifth stage how the GFR is decreasing. So that is how the stages of chronic renal failure is determined. Now moving on to the clinical manifestations of chronic renal failure. So in the clinical manifestations, what we can see, the signs and symptoms would definitely depend upon the underlying causes or the underlying renal diseases. So as we have seen that in the etiologies also, there are several renal disease which can cause chronic renal failure in long term, right? So it would definitely, the signs and symptoms would depend on the underlying renal disease. So we would discuss here in general what are the clinical manifestations that we can see in a child with chronic renal failure. So you can definitely see lethargy, anorexia and vomiting. Then there will be also growth failure or short stature. Then there can be failure of thrive, pallor we can also see edema, and it would be mostly present in the lower extremities. Then there will be hypertension, because you can understand there is fluid and electrolyte imbalance because the kidney is not able to function properly. And then we can see proteinuria, and other than that there will be hematuria and urinary tract infection. Now moving on to the diagnostic measures. So for diagnostic measures, the first thing that we will do is collecting history definitely, and then comes your physical examination. Now in physical examinations, what are the findings that you can get? So first thing, there would be pallor and a sallow appearance. The child will have short stature, and also along with that you can see edema, especially in the lower extremities. You would also notice hypertension. So these are some of the abnormal findings that you can get during the physical examination. Now next part is our investigations. So in laboratory findings, we can find out elevated BUN and creatinine. Along with that, we can also see reduction in GFR. Then there will be hyperkalemia, hyponatremia. We can also find out about acidosis or elevated uric acid. And then we can also see hematuria and proteinuria. So to find out these things, what are the diagnostic measures that we can opt for? Blood test, and then we can do urine analysis, and then we can also do renal ultrasound. So that would help us to know about if there is any presence of cyst or any obstruction present in the upper urinary tract. And it would also help us to determine what is the kidney size. Then we can also do renal biopsy to examine the tissues and cells. Renal endoscopy and nephroscopy also can be done, and along with that we can also do ECG to find out if there is any abnormal, if there is any fluid and electrolyte imbalance. So that was all about the diagnostic measures. Now moving on to the treatment or management. So the first thing we will talk about management is what is our goal of management, what we are trying to do here, right? So first thing is there is absent or diminished renal function, right? That we have to replace. So that is our first goal. And the second thing is that this renal dysfunction is progressing, right? This is a chronic renal failure. So we have to somehow slow this progression of renal dysfunction. So first let us see about the pharmacological therapy. So the child will be given calcium and phosphorus binders to treat the hyperphosphatemia and the hypocalcemia. Then the child will be given digoxin and dobutamine to treat hypertension. Then to treat the seizure, there will be anti-seizure medications like diazepam, and then erythropoietin would be given to treat the anemia. And along with these things, there would be also, if it is very severe case, in that case, we have to start with dialysis. Now, this was all about the pharmacological management. Now, moving on to the several management that we have to deal with when we are having a child with chronic renal failure. So the first thing would be, maintaining fluid and electrolyte balance. Now, while maintaining the fluid and electrolyte balance, we might have several scenarios. So, for example, there can be, polyuria with urinary sodium loss. So, in that case, we have to provide high volume in low caloric density feeding. And along with that, we have to also provide sodium supplements. The second scenario can be that the child will have high BP, edema and heart failure. So in that case, we have to provide feeding with low sodium level. And also along with that, the child should be given with diuretic therapy. And then if the child is having hyperkalemia, in that case, if we are, managing the fluid and electrolyte, so in that case, we have to make sure that whatever diet we are providing, it should be low in potassium. So we have to make sure that there is, low potassium intake orally. So that is how we will manage the fluid and electrolyte. Now, next thing is, we also know that one of the major problems is acidosis, right? So for that, the child will be given with sodium bicarbonate tablet. Now, moving on to the next part, which is nutrition. So for nutrition, again, we have to make sure that the diet what we are providing is, but it's suitable for the child. So definitely there would be certain restrictions in the diet. And there would be dietary restrictions of potassium, sodium and phosphorus. We also have to make sure that we maintain the calorie requirement for their age, and then we have to provide zinc and iron supplement if there is deficiency, and also along with these things we have to give water soluble vitamin supplement. Now the next thing is how we would manage hypertension. So for hypertension, the first thing that we would do, definitely we would make sure that there is salt restriction in the diet, right? And along with that, we would also start with the diuretic therapy. So for diuretic therapy, we can give hydrochlorothiazide or furosemide. Apart from these things, the child will be also given with ACE inhibitors, then calcium channel blockers and beta blockers. Now the next thing is immunization. So this is very important. So we have to stick with the immunization schedule, and we have to make sure that we don't miss any of the vaccines for the child. And many times the child, they would be on immunosuppressive drugs, or they might be they might be going for a renal transplant. So in that case, the child will be on immunosuppressive drugs. So in that case, we have to make sure that we don't give any live vaccine. We have to avoid that. So if you want to give any live vaccine, you have to make sure that the live vaccines are given to the child before the renal transplant. Now moving on to the nursing management. So in nursing management, first we would discuss about the nursing diagnosis. So what are the nursing diagnoses that a child will have with chronic renal failure? So the first thing will be there is excess fluid volume. And this excess fluid volume would be there because there is decreased urine output. There is also retention of sodium and water, right? So the kidney is not functioning properly, and that is why the sodium and water is getting retained in the body, and also there is decreased urine output. So all these things would cause excess fluid volume. The child will also have imbalanced nutritional status, less than body requirements, because this would be related to nausea, vomiting, because or anorexia. The child will, as we have seen in the clinical manifestations, that the child will have anorexia, vomiting and nausea. So these things would cause imbalanced nutritional status in the child. And also we know that there is retention of waste products. The child will have anemia also. So these things would again cause activity intolerance, because the child will have fatigue also. So we can say activity intolerance related to fatigue or anemia or retention of waste products. Now moving on to the nursing intervention. So in nursing interventions, the first thing would be seeing the fluid and electrolyte imbalance, right? So for fluid and electrolyte, what we have to do as a nurse, we have to continuously monitor the child. We have to assess the child so that we can find out if there is any potential source for imbalance of fluid and electrolyte. Then we also have to see the nutritional intake. We have to make sure that the child is getting adequate nutrition, and then we should also make sure that the child is taking high biologic value of protein, that is the egg or the dairy products. And then medication. So you have to make sure that the parents of the child understands that what are the medications that the child is taking, and how it will help the child, and what are the timing for taking the child. So all these things you have to explain to the parents, and along with that you have to make sure that the child is taking adequate rest. Now, apart from these things, as a nurse, we also have a role in educating the parents, right? So we have to educate them on several things. Well, apart from these things, as a nurse, we also have a role in educating the parents, right? So you have to educate the parents on several things. The first thing is that if there is any problem, for example, if the child is having diarrhea or abdominal cramps or any sort of problems like that, you have to, make sure that the parents understand that how important it is to notify the physician. So if they find out any sort of problem like that, they have to inform the doctor. And the next thing, you have to make them understand that it's very important for them to take the child for follow up. Well, so this was all about chronic renal failure. I hope you have got a better insight about the topic. Thank you.